Question. Does it hurt getting a cavity filled? I had a patient that had never gotten cavity before. And so the patient's question to me was, is this going to hurt? A lot of times patients that have never had a cavity before, never had a treatment before, there's a lot of questions that come along with it. And this is one that I hear all the time. So you got a cavity and now you're dreading getting the filling. Does it really hurt? The part most people worry about is the numbing part. So when you're getting local anesthetic, there's a lot of different things that the doctor can do to help you when it comes to getting you comfortable. The filling is not going to hurt. Maybe you have a little bit of pain when they're giving you the shot. And that's usually a lot of the issues that people have when it comes to coming to the dentist altogether. They hate the needle. They hate having to get a shot. The filling, the actual procedure, once you're numb, you're not going to hurt at all. But the beginning, you know, some people really, really hate that shot. You know, it's only a quick pinch. And after that, you won't feel anything. Once you're numb, we remove the decay. We add some medicaments in there or some medicines in there to the tooth to fill it up. And we smooth it out. And that's it. Now, you may feel some pressure, but you should not feel any pain. If you are feeling pain throughout the procedure, it's important that maybe to ask the doctor to give you a little bit more anesthetic and let them know that you're feeling something. What I like to do when I give patients the shot is to, one, make sure that they're numb. So I test the area before I even start to get the drill or anything else. I test the area to make sure that it's good and numb. Then, after I test the area, then I look to start the procedure. If I notice anything that seems off, their forehead scrunches up, they're white knuckling it, meaning that they're holding the chair really, really tightly, they're fidgety, or they start to move their legs or anything like that, you know, I usually stop just to make sure that the patient is comfortable before I start to proceed and do anything else. The filling, the actual procedure after you're numb should not hurt. If you are feeling pain or discomfort during the procedure, it's important to let the doctor know. How do you let the doctor know? The way if you were to come to see me, I tell you to make sure that you raise your left hand very, very slowly, not the side that the doctor's on. So I'm a right-handed provider. So I ask my patients to raise their left hand because that's away from the area that I'll be working on, which is on their right side. The reason why I tell patients this is I don't want you to bump me to where, you know, that handpiece that moves really, really fast in your mouth, cut something else. That is a thing that can happen. The other thing is everything on my side is sharp and moves really, really fast. Everything on the dental assistant side is plastic or, you know, doesn't hurt. So always raise your hand on the assistant side. You can also make little noises, like make a grunt or something like that. That will also tell the provider to stop. If they don't stop, you know, that's something else, but they should stop to make sure that everything is okay before they proceed on with your care. I know that makes sense. You guys are blessed. I want to hear your questions. All right.